test on this one topic. One topic has been on the NCLEX 10, 15 years ago. Literally, somebody just took their NCLEX yesterday and it was on there. I'm going to tell you exactly what you need to know. No more, no less, no fluff. Make sure you're saving this, sharing it out to help somebody else. Let's go. Did you know that Tetralogy of Fallot, a cardiac disorder, call it TOF, genital heart defect, has 4 main problems. Make sure you watch this to the end so you can get all 4. The first problem is pulmonary stenosis. This is the narrowing of the pulmonary valve or artery. This blocks blood going back into the heart, therefore making it harder to get oxygenated. Second problem with this is it has right ventricular hypertrophy. This right ventricle has to pump harder against that narrowing pulmonary artery, so therefore the muscles thicken. Think of it as like you're working out. Those muscles are building up, but that constant pressure is making the walls of the ventricle even thicker because it's meeting resistance going back into the lung. Third problem is your overriding aorta. The aorta will sit on top of both of the ventricles instead of just the left ventricle, which means it's pulling blood from both sides of the heart instead of just the left. What happens mixes oxygenated blood with deoxygenated blood. Fourth problem is your ventricular septum defect, what we call VSD. This is a hole between the ventricles. This allows the blood to flow from the right to the left, especially when that right side of the heart has pressure. It's going to push that fluid over. Know the signs and symptoms. First one is going to be cyanosis. This is what we call the blue baby. They're going to have clubbing on the fingers and the toes, and this is due to hypoxia. Next is your TET spells. This is your sudden hypoxic episodes, and they're triggered by crying, feeding, and exertion. Another sign is going to be the squatting, knee to the chest, because that knee to chest positioning helps to promote oxygenation by increasing that systemic vascular resistance. The nursing interventions that will be on your NCLEX, they will want you to know is number 1, during the TET spells, you are going to do that knee to chest positioning first, and you will administer oxygen, and then you will possibly administer morphine. You need to monitor for worsening hypoxia. Educate the parents on the signs and symptoms of hypoxia. Permanent solution to this is surgery. Here's my memory trick. Use PROVE for Tetralogy of Fallot, P for pulmonary stenosis, R for right ventricular hypertrophy, O for overriding aorta, V is VSD, ventricular septal defect. Is 4 defects. PROVE, it is TOF. NCLEX takeaway for you is remember, if you see a question asking about the interventions for a TET spell, answer is going to be knee to chest positioning first, because that alleviates pressure and improves oxygenation immediately. Make sure that you are saving, sharing this out, writing notes while you're watching this. I made it this far in the video. Hit like, subscribe. Give me a comment down below about something you want me to go over that is just something that's a little confusing for you, and I can go over it. Grab my study notes that are at the top of my page. That is going to help you study. Stay focused. Study only what you need to know. No more, no less, no fluff. This helps, and happy studying.